Hello, my name is Monique and I'm a student nurse at the University of South Florida, and today I'll be providing some education about nitroglycerin. So nitroglycerin is a medication prescribed by many providers to treat chest pain. Some providers will prescribe it as to be taken daily for chest pain, and other prescribers will be prescribing it to be taken only when you're feeling that chest pain. So there's many different ways that nitroglycerin can be taken. It can be taken as a tablet that you would swallow orally, which is extended release, as in it just slowly releases some of the medication you need over time. Other ways is sublingually, which means under your tongue. It can be also prescribed as a nasal spray or a patch that you put on your skin. So the way that nitroglycerin works is it increases the blood flow to your coronary arteries, and it opens up your vessels, as in your veins, your arteries, and your arterioles. So this dilation or increase of size in these vessels will increase blood flow if you're having chest pain to relieve those symptoms. Okay? So one very important fact that needs to be known when you're taking nitroglycerin is that you cannot be on any medication for erectile dysfunction. So for men that are currently taking medication for erectile dysfunction, you would need to discontinue that in order to be able to take nitroglycerin. So the way erectile dysfunction medications work is it increases blood flow to certain areas of your body, and nitroglycerin also increases blood flow as well. So if you're taking both medications at the same time, it can cause a dangerous drop in your blood pressure, which could lead to many other complications. So if you're taking nitroglycerin, you cannot be taking any erectile dysfunction medications. Okay? So this particular prescription was given to be taken sublingually. So you would take the tablet of nitroglycerin and you would hold it under that pocket under your tongue, and you would leave it there until it dissolves completely. It is important to not swallow this medication because it will not work. If you swallow the medication, you'll not get the relief that you need. So it's very important to leave it under your tongue until it completely dissolves. Some providers will allow you to take up to 5 milliliters or 1 teaspoon of water. You just put it under your tongue and it'll help the medication dissolve, but you would still need it to be dissolved under your tongue. At this point, I would pause and I would ask a question and have the patient teach me how to do the medication sublingually. So I would ask, so why is it important for you not to swallow this medication, and how would you take this sublingual medication? Okay. So the way it works when you take a medication sublingually is that the medication will dissolve into the tissue under your tongue, and it will be absorbed into your bloodstream relatively quickly. So it should work within normally about 5 minutes. Okay, so some side effects of nitroglycerin include headaches. So almost every patient that will take nitroglycerin will complain of a headache. This is due to the opening of the vessels in the brain as well, increasing blood flow. So many patients will experience a headache. Some other side effects include dizziness. So when you're taking this medication, especially for the first time, you might want to sit down just in case you're feeling dizzy. Some other side effects include facial flushing, so warmth and redness in the face, and lastly, tingling in the mouth. So that tingling sensation is the medication working. So a lot of patients will experience tingling. At this point, I would pause again and ask the patient to tell me a couple side effects of the nitroglycerin medication. Okay. So a few more things. So the way your provider prescribed it, a lot of times they will prescribe it this way, is you would take 1 nitroglycerin tablet when you're feeling chest pain. So you'd put that 1 tablet under your tongue, you'd wait for it to dissolve. After 5 minutes, if you're still feeling chest pain, you could take a second dose. So you take a second nitroglycerin tablet, put it under your tongue, and wait an additional 5 minutes after the medication has dissolved. After 5 additional minutes, if you're still experiencing the chest pain, you would take a third dose. So you could take a third nitroglycerin tablet, put it under your tongue, wait for it to dissolve, and then you'd wait an additional 5 minutes. After 5 more minutes and 3 doses, do not take any more of the nitroglycerin tablet. You would call 911 at this point. So it's very important for you to not drive yourself to the hospital. You call 911 and let them know, hello, I'm currently experiencing some chest pain and I have taken 3 doses of nitroglycerin without any relief. And they will call an ambulance for you to come pick you up and take you to the emergency department. So it's very important to go to the emergency room, call 911, and contact your provider at this time. Some other tips would be to carry your nitroglycerin with you at all times. You never know when you're going to experience a chest pain and when you'll need the tablet. So you can be at the grocery store, you can be at work, you can be running errands, you just never know. So it's important to keep the nitroglycerin tablets on your person at all times. And lastly, you want to get this nitroglycerin prescription refilled every 3 to 5 months. So after 3 to 5 months, the potency or the strength of the medication decreases drastically. And you want the medication to work as effectively as possible. So every 3 to 5 months, you want to get that prescription refilled and throw away the old prescription for your nitroglycerin. And lastly, I would pause again and I would ask the patient, okay, so how many tablets of nitroglycerin should you take before you call 911? I would also ask them about how many minutes between doses of nitroglycerin would you wait before you take a second or a third. And I would have them teach back everything that I just spoke to them. And if there was any things that they didn't understand or anything they got correctly, then I would go over that section with them again. Okay, thank you.